focus. Ideate, innovate, enable.
You renew yourself every day. Sometimes you're successful, sometimes you're not. But it's the average that counts. This observation was made by Satya Nadella, CEO of Microsoft. To my mind, this quote perhaps distinguishes the winners from also rans. The winners go that extra length to get the desired results. They keep pushing the envelope. They never give up. This is because they never lose hope. And this is what separates men from the boys. We are here to talk about such winners, winners who save your life and put smile on the face of your family. Yes, we are talking about the winners of India Healthcare Awards 2014. This award, instituted in 2010, recognizes and rewards healthcare practitioners across the country for their skills, care, dedication and commitment. The award, now in its 6th year, is a tribute to the selfless and tireless commitment of those doctors and institutions for making a positive difference to your life. In this episode, we have cherry-picked a few winners who, in a way, reflect the changing landscape of the India healthcare sector. Each of these stories, I feel, will touch your heart. Take a look.
Awarded for Best Single Specialty Hospital in Gastroenterology, Asian Institute of Gastroenterology, Hyderabad. Asian Institute of Gastroenterology was established as a new concept of daycare unit where major endoscopic surgical procedures could be done on an outpatient basis without resorting to hospitalization. Since then, the institute has become one of the largest referral centers in Asia for therapeutic endoscopy. It has the credit of doing the largest number of ERCP procedures in the world. In addition to routine gastrointestinal procedures like endoscopy, colonoscopy, ERCP, diagnostic and therapeutic, the institute is one of the few centers in the country doing endoscopy ultrasonography, endoscopic sewing, capsule endoscopy and ESWL extracorporeal shockwave lithotripsy.
It's indeed a pleasure and a big honor to receive this prestigious Indian Healthcare Awards from CNBC, TV18, ICICI, Lombard. And this is the third consecutive time our institute, Asian Institute of Gastroenterology, Hyderabad, is getting this award. And apart from the regular practice of treating patients, we also do a lot of research in basic sciences as well as advanced endoscopy and surgical fields. Financially also, our hospital is not more like a typical corporate hospital, but in the form of healthcare to reach the common man. That's the main motto and aim.
Awarded for Best Single Specialty Hospital in Oncology, Baswatarakam Indo-American Cancer Hospital and Research Institute, Hyderabad. India is alarmingly being touted as the cancer capital of the world. The Baswatarakam Indo-American Cancer Hospital and Research Institute is a haven for those whose very lives are being stalked by this killer disease. Established in 2000, Baswatarakam Indo-American Cancer Hospital and Research Institute is a super specialty center. The center offers state-of-the-art infrastructure and is technologically up-to-date. It offers treatment on par with the world standards of excellence and is accessible to all at an affordable price.
It's a wonderful feeling, primarily, for being recognized for all the efforts that the entire team, comprising of over 1,000 employees in the hospital, have been striving extremely hard to give complete, safe treatment for the cancer patients in the Baswatarakam Indo-American Cancer Hospital back in Hyderabad. The award gives us a lot of strength and fights the fatigue that our professionals undergo while serving these patients. So it's a great recognition and we are very happy and excited.
We meet all the criteria of affordable, available, accessible. All 4 criteria because we are a non-profit institution. We don't return any patient whether he can pay or not.
Correct.
So we take care of everybody from the who can pay and who cannot pay. So that is our specialty. And we provide the best care which science can provide.
Awarded for Best Single Specialty Hospital in Endocrinology, MV Diabetes Hospital, Chennai. India is earning the dubious distinction of becoming the diabetes capital of the world. the Chennai-based MV Diabetes Hospital is putting its might behind to fight this silent killer tooth and nail. They are driven by the hospital motto, every person having diabetes should be helped to live his normal span of life in perfect health. With the registration of over 3 lakh patients till date, it is indeed living up to the motto. MV Hospital for Diabetes, situated at Royapuram, Chennai, was established by late Professor M. Vishwanathan, doyen of diabetology in India in 1954 as a general hospital. In 1971, it became a hospital exclusively for diabetes care. It is recognized as an internationally known tertiary care center for referral of diabetic patients requiring super specialist opinion and management.
It's a great moment to win this India Healthcare Award 2014-15, and that hosted by CNBC TV 18. I think we are the first hospital for diabetes in India, the MV Hospital for Diabetes at Chennai. It was formed in 1954 by Professor M. Vishwanathan, and it finished Diamond Jubilee last year, 60 years. So probably the oldest hospital for diabetes in India. So this is a WHO, World Health Organization collaborating center for research, education and training. We report to WHO in Geneva, where we do research, education and training to doctors from the region, entire region up to North Korea. We train doctors for diabetology and so on. And what is important is we have developed a model for diabetes care for the developing countries, because diabetes today is a big problem in India. There are about 60 million people with diabetes, and what our hospital has done is developed a model for diabetes care. At a very low cost, you can actually treat diabetic patients and try to prevent complications in them and try to help them to get control of their diabetes. It is the first hospital for diabetes, first of all, and the focus is on not just patient care but on research, education and training, and that is why the World Health Organization has designated us as a collaborating center. And what is important is this was the first hospital in India which developed a model for diabetes care. How do you treat diabetes care with low resource setting like in Africa or Indonesia? How do you treat diabetes? So this hospital gave an example of how we can treat diabetes with not much cost, and that will go a long way in preventing complications.
Well, it was indeed interesting to see how these hospitals are working hard to fight 2 major health issues facing our country today, diabetes and cancer. On that note, it is time for a short commercial break. When we come back, we will bring you stories of how doctors are giving second lease of life to those with knee problems. Stay tuned. Welcome back. You're watching the winners episode of India Healthcare Awards. A good hospital is recognized by its efficient and well-trained team of doctors, nurses and paramedics. It therefore becomes very important to look at the medical colleges for training doctors of tomorrow. Here is a close look at KPC Medical College and Hospital, which is seamlessly integrating teaching with practical training.
RSBY Award for Outstanding Service to the Community, KPC Medical College and Hospital, Kolkata. KPC Medical College and Hospital has the unique distinction of being the first private medical college in West Bengal. It was set up in 2007 under a public-private partnership program initiated by the KPC Group and the West Bengal government. KPC MCH is a registered society formed by a non-profit foundation sponsored by orthopedic surgeon and medical entrepreneur Dr. Kali Pradeep Chaudhary. The fledgling institute has 21 departments including forensic medicine, microbiology, psychiatry, anesthesiology, dermatology and anatomy. The college has been selected by the World Health Organization as a participant in an international collaborative effort in preventing trauma deaths. KPC MCH is one of the 50 hospitals in India selected by the WHO for the project. The hospital will soon conduct drug trials for tuberculosis in collaboration with a foreign company.
Basically, our motto is to make accountable healthcare available and accessible to the mass population of our country. So I believe actually our hospital is a toddler, it's only 7 years old. So I believe we have been able to achieve that target by this time.
and definitely we are happy that somebody recognizes that whatever effort we have put in these days.
Awarded for Best Multi-Specialty Hospital in a Non-Metro, Kovai Medical Center and Hospital, Coimbatore. Kovai Medical Center and Hospital is a 750-bed multidisciplinary advanced super specialty hospital which credits in offering total and comprehensive healthcare solutions for a wide range of ailments. Having emerged as the most sought-after multi-super specialty hospital in the Kongu region over the past 2 decades, it is indeed a pioneer in the health space. Super specialty procedures like open heart surgeries, valve replacements, kidney transplants, hip and knee replacements, complex brain surgeries and advanced spine surgeries are done regularly, and the systematic approach is patient-oriented, timely and equitable. The exceptional success rate has enabled KMCH to remain a pioneer in integrated healthcare in India.
Kovai Medical Center, KMCH, is in Coimbatore. It is a 750-bed hospital who provides up-to-date medical care in Coimbatore. And it is different from other hospitals is because it gives quality care at affordable cost. That is what the Kovai Medical Center is. And it gives poor people good treatment with so much concession treatment. That's why it is away from the other hospital. And we also do CSR activities helping the poor people. The Kovai Medical Center has all the medical specialties in whatever available anywhere in the world. We provide there in non-metro hospital. Non-metro hospital, we provide all the facilities in at lowest cost. That is what the Kovai Medical Center is, and it is doing well. And I am thankful to CNBC for the award, giving this award.
Awarded for Best Multi-Specialty Hospital in a Metro, Shalby Hospitals, Ahmedabad. Shalby began its journey as a joint replacement center in 1994 by Dr. Vikram Shah. Shalby had humble beginnings, starting off as a small 15-bed single specialty unit. Today, it has transitioned to a technologically advanced multi-specialty hospital offering care in over 25 medical disciplines ranging from cardiology, cardiothoracic surgery, trauma, cosmetology to ENT. Shalby boasts of the highest number of replacement surgeries done in a single hospital anywhere in the world. With patient care and infection control being the focus, Shalby Hospitals boast of Class 100 operation theatres for enhanced infection control. Single-level enhanced emergency care is another feature making the hospital a notch above the league in critical care.
Great pleasure to win this award, CNBC in TV 18 India Healthcare Awards, and we are happy to receive this award for recognizing our hospital as the best multi-specialty hospital in metros. We do highest number of replacement in the world as on today. We do almost 7,000 to 7,500 surgeries per year as an individual hospital.
Knee problems are on the rise, but Shalby Hospital is there to provide that big relief. And so is Kovai Medical Center. This hospital too is doing a phenomenal job. Hope their tribes keep increasing. On that positive note, time for another short break. Stay tuned. Welcome back. You're watching the winners episode of the India Healthcare Awards. By definition, hospitals need not always be a somber affair. It can be a joyous moment too, especially for parents. In this segment, we take a close look at some of the maternity homes and children's hospitals for whom winning the India Healthcare Award has become a way of life.
Awarded for Best Single Specialty Hospital in Gynecology, Gunashila Surgical and Maternity Hospital, Bengaluru. The Bengaluru-based Gunashila Surgical and Maternity Hospital has brought happiness into the lives of childless couples. Established in 1985, it is among the first centers in India when the global population of test tube babies was under 1,000. The hospital facilitated South India's first IVF baby in 1988, at a time when the concept of IVF was accessible only in advanced countries. The hospital has provided treatment for over 25,000 childless couples and delivered 6,000 babies in 25 years. In vitro fertilization requires continuous upgradation with infusion of technology to address infertility issues.
It's been a fantastic experience. We won it for the second time in a row. The first one was in 2013 and now again we are winning it. It is a very gratifying experience, and I'd like to thank CNBC TV 18 as well as ICICI Lombard for having given us this award. Being a doctor is hard nowadays, and I feel that these kind of awards really reinforces the fact that society at large still appreciates our contribution to healthcare.
Awarded for Best Single Specialty Hospital in Pediatrics, Rainbow Children's Hospital, Hyderabad. This hospital has won the India Healthcare Awards twice in a row. It is the first corporate children's hospital in India, started on 14th November 1999 on Children's Day. Setting the benchmark in neonatal and pediatric intensive care, Rainbow has played a major role in saving thousands of critically ill children and has emerged as one of the best children's hospitals in the country. Rainbow Hospitals aims to provide high standards of care for the mother, newborn and children so that none of them is deprived of a tertiary care facility. Indeed, here the measure of success is the number of smiling faces.
We are very excited. This is the second time we won the India Healthcare Award from CNBC TV 18 along with ICICI Lombard. We won the award in 2011 when we were a 150-bed children's hospital. Today we are about 700-bed children's hospital group, which means India's largest children's hospital group. This award is very special for us at this moment because the children's healthcare is very different. And we are the ones, Rainbow is the one which revolutionized the children's healthcare in this country. When people believe that now children's healthcare is not going to be viable, is not going to make sense in expanding.
This is very special. We feel that we are humble and for people having sort of recognized our efforts. From the last 15 years we have been striving to create a mark in children healthcare. And this is a bonus for us to say that we are on the national levels. The second time we won the award, and earlier children health was considered as a miniature adult, and children don't need only small care, they need as much care as any adult, and that is what Rainbow Children's Hospital has shown, that it's a multi-speciality children's hospital and all of children's specialists work like a team to improve the quality of child health care. We thank ICICI and CNBC TV 18 to have recognized our effort.
Awarded for Best Multi-Specialty Hospital in the Megapolis, PD Hinduja Hospital and Medical Research Center, Mumbai. Hinduja Hospital is one of the flagship hospitals in the country for tertiary care. The hospital was founded in 1953 with mere 30 beds. By 1986, the hospital expanded to 300-bed tertiary care hospital complex, and since then, the hospital has never looked back. The hospital till now has treated 1,75,000 inpatients for high-end tertiary care, has treated over 3 million outpatients successfully, performed over 1 million radiological investigations.
We feel very nice and thankful to the organizers who have identified that the patients have trusted us, and they have recognized for the good clinical outcomes which are delivered by a hospital and for the good patient care which is given. So we are really thankful and happy to receive this award third time. Our hospital it believes in the vision of quality healthcare for all, and the principle of giving ethical value-based delivery, which is from our vision of our founder Shri P.D. Hinduja and carried forward by our trustees Ms. Veenu Hinduja and Mrs. Usha Raheja, which has been imbibed in each and every member of the hospital, that patient care is the most important thing. And so all activities are focused on improving quality and improving patient care. So we do that, and our outcomes are very good. Our doctors are very well trained, all are committed. We do a lot of rural programs, we do a lot of work for the underprivileged sections of the society, and we offer multi specialities, so we are considered as a good hospital. The idea of getting this award and for being recognized for excellence is probably will help us to improve better and to ensure that we continue on the path of excellence, so that whatever needs to be improved, we continue to do that, and we continue to win this award year after year.
Awarded for Best Single Specialty Hospital in Neurology, Institute of Neurosciences, Kolkata. The Institute of Neurosciences, Kolkata is the result of a dream of one individual, Dr. R.P. Sengupta, an eminent neurosurgeon practicing in England since 1961, but with roots in Kolkata. The absence of proper neurological treatment, including neurosurgery, care for psychiatric problems after head injury and stroke, and neurorehabilitation, particularly amongst children in the eastern region, prompted Dr. Sengupta to set up a non-profit establishment in Kolkata for providing neurological care of international standards at affordable prices. This is a one-of-its-kind hospital in eastern India for treatment of neurological disorders with 150 beds, 11 fully furnished examination rooms, 4 operation theatres with state-of-the-art equipment, treatment at subsidized cost for the less privileged. 20% of the beds are reserved for this section of patients and children.
No doubt, it's a great pleasure for us from the Institute that we received this award for consecutive 2 years from the CNBC TV 18 India Healthcare Awards. So really it's a great pleasure for us that we have received this. Basically, this hospital is only for neurosciences, that we cater for neurology, neurosurgery, psychiatry, rehabilitation. Whatever you can think of in neurology, we do that. The difference is that we give proper standard care. Whatever the new things that are happening in the world, so it's available under the one roof that we offer. No doubt, whatever you can think of in neurosciences today, so we deliver. We have the specialty clinics like epilepsy, like movement disorders. We do DBS, deep brain stimulations. We do difficult epilepsy surgery. We do different spine surgery. We do electroconvulsive therapy modified for psychiatry. So whatever in neurology we are doing there, and we are catering whole of the eastern India and the neighboring countries, particularly Bangladesh, Nepal, Bhutan, so many on, and even from some West Indies countries also. Actually, if you ask, there are so many factors. One is no doubt your responsibility for the patients, no doubt. That is your best primary target, that being a doctor, you should care for it. I'm thankful to every doctors and as well as the non-doctors who also cooperate, because the patient comes and when entered into the gate of the hospital, the care starts there. How you told them, how you care for them, the sympathy starts there. A front desk people, how they are managing and everything. So we have streamlined those things so that the patient satisfaction remains with them. Every time we update the patient relatives about the conditions and everything, so we had discussions with the patient relatives at the end of the day what we are thinking to do in the next for the patients being, and we give them also the education that this is the available best care that we can give, and this is the standard of care that we offer. Besides this, no doubt, if you say a doctor when seeing a first patient, no doubt he has his every high intention to see good, but we take care so that the last patient gets the same care as that of the first patients. That gives a flavor that you are treating whole of the patient's lot in a day similarly in the same fashions. So patient satisfaction is ultimate priority to us, and the standard of care should be the standard ones that is throughout the world. That I think we took into account for having our day-to-day practice.
Well, there is a common thread that runs across all these stories, and that is passion, dedication and commitment of doctors. They are a selfless lot. I salute them. On that note, time for another short break. More interesting stories are lined up on the other side. Stay tuned. Welcome back. You're watching the winners episode of India Healthcare Awards. In this segment, we are featuring some of the winners who bagged the prestigious India Healthcare Award for making a big difference to thousands of families living across the country. Take a look.
Awarded for Best Single Specialty Hospital in Psychiatry, National Institute of Mental Health and Neurosciences, Bengaluru.
So we provide healthcare that is free, that is accessible to people,
and people from all over India come to get treatment and consultation for mental health disorders. So we give quality care, and the cost that families and patients have to pay is really minimal. We are a government hospital. We are now an institute of national importance, so the government has recognized us as an institute of national importance. So we are probably one of the only government institutions providing quality mental health care all over the country. NIMHANS has been in the forefront of mental health, not just in India, but also in the whole Southeast Asian region. We have been actually training and consulting with many people in the CRO region and helping with developing of mental health resources and mental health policies and plans in the whole of this Southeast Asian region. So NIMHANS is really the place where people should come to when they want to train or get treated or do anything to do with mental health care. And we are trying our best now to see that we can multiply ourselves and see that we can have NIMHANS-like institutes in many parts of the country, just like there are AIIMS-like institutes in different parts of the country. We're trying to see that there can be NIMHANS-like institutes in different parts of the country, because one of our visions is to see that every state in the country has quality mental health care, which is so important.
Awarded for hospital with Medical College Metro, Nizam's Institute of Medical Sciences, Hyderabad.
You know, our hospital is a model hospital because it's a government hospital, yet it's a self-sufficient, self-generating hospital. Normally you think of government hospitals where government gives a budget, but in our case we generate our own money, we generate our own budget. Of course government helps particularly the poor people who are below poverty line, so therefore it's different from others. And we are also into education. A lot of people are trained in our hospital, particularly for super specialties like cardiology, neurology, gastroenterology. So super specialty hospital with self-generating capacity. In these days, many private hospitals have come, but they are not affordable. They are only for the higher, strata of society. But our hospital gives the same care to the lowest of the lowest section of the society, and I think that's a challenge, that the same treatment which is available to people who can spend a lot of money, same treatment we are able to give to the lowest and the poorest people, and that's what makes us different from the others, and I think that's what must have come into our favor for us to win this award.
Awarded for hospital with Medical College Non-Metro, Jawaharlal Institute of Postgraduate Medical Education and Research, Puducherry.
The uniqueness of the institution is that it provides almost all care free to people. So 99% of the people are below poverty line. We provide all the care and drug free. Our hospital is what we call a safety net hospital, where the people who have no ability to pay and no insurance, like a government hospital, but we provide the quality care, what we call value care. We provide the high quality at the lowest possible cost, at affordable cost. And almost all patients do not pay anything for the care in our hospital.
Awarded for Best District Hospital Grade 3, District Hospital, Ahmednagar.
Our hospital is a 500-bedded hospital. It is we are always trying to how to reduce the maternity mortality rate and infant mortality rate and give the services, minimum need services to the poor community. So our hospital is different from other district hospitals. We are trying to give the best services to the common people and poor people and below poverty line peoples, and we are thinking that everybody should get all the services, and our IMR and our MMR, that is maternal mortality services, and infant mortality death rate should be reduced up to the mark that our Maharashtra is second, then Kerala. So we are coming
Our district is also thinking that we are nearest to the Kerala. So our maternal mortality rate is now 68. So we are thinking that our maternity should come to above 61. And our infant mortality is 25. So we want our infant mortality rate to single digit, that is up to 9.
Wilbro Innovation Foundation Awards for Excellence in Primary Healthcare. Sudha Vasvu Healthcare.
We run primary healthcare centers, and that itself is very different from, I think, all the other winners. We focus on comprehensive primary care, mainly in decentralized and rural settings. Our model is to look at as many conditions as possible at the primary care level, and 95% of illnesses can be addressed at that level, and that's what we are aiming to do. We also partner with different organizations across the country to scale it up.
I think the main three things that we focused on was basically how do we give healthcare that's accessible, affordable, and of course deliver quality as and when it is there. So I think technology has helped us a lot, even though it's not we cannot call it separately as a back supporter of pusher for us. It's basically getting technology to actually make healthcare at a rural level and at a primary care level accessible, affordable, and with a lot of quality.
Awarded for taking healthcare to rural places, Prakash Amte.
We are happy to receive this award, but I humbly say that it's not that we too who have done the work for the healthcare for the tribal. My whole team who has worked with me for the last 40 years, we take this award on behalf of all these my colleagues. And really this will encourage other NGOs and other individuals to get to the good work in the healthcare system. And this encouragement will help poor people to get good health services in their own areas. This institution was started by my father, Baba Amte. And he named it as Lok Biradari Prakalpa, that means People's Brotherhood. And why he started this institution? Because there were no healthcare services in that area. It's a primitive tribe called Madiyas. They had never seen modern medicine. They were no clothes to wear. Even they didn't have food to eat. So they were totally dependent on hunters and gatherers. So when my father took us there for a picnic, and he said we should do something for this very, very backward community. And I, being young, at the age of 22, I went there. And I say, if you start this work, we will carry on with your work. And since 1973, we started this project, Lok Biradari Prakalpa Hemalkasa. It's in Garchurli district, which is famous for violent activities. And we started with our because we both were doctors, we started with health system. Gradually we included the education, awareness about their rights, and also farming, traditional farming. So I'm happy to say that in the last 42 years now, there is a lot of awareness about healthcare. Blind faith has come down. Given an opportunity through education, about 10 tribal students have become medical graduates and postgraduates. Many more have become engineers and teachers and farmers and those like that. So it's a great satisfaction that with our efforts we could make them aware and lead a normal life, make them in the mainstream.
RSBY Award for Outstanding Service to the Community, Shankar's Eye Hospital, Punalur, Kollam District, Kerala.
I dedicate this award to my staff who is responsible for this award. I think because of RSBY, my hospital has improved a lot, and I thank for the organizers for this award.
Awarded for Best Single Specialty Hospital in Ophthalmology, LV Prasad Eye Institute, Hyderabad. Awarded for Best Single Specialty Hospital in Cardiology, Fortis Escorts Heart Institute, Delhi. Awarded for Best Single Specialty Hospital in Orthopedics, Parekh Super Specialty Hospital, Ahmedabad. Awarded for Best District Hospital Grade 2, Seth Shri Vallabh Ramdev Pitti Rajkiya Hospital, Nagaur.
I am from Rajasthan, and that is very remote area. Nagaur is very remote and desert area, and there is accessibility and acceptability is very poor for the people. We are trying to our best. We are giving best quality of services. In my district hospital, I am giving telemedicines and CT scan is also available. And quality of services are very good in our hospital, and the services is very good, and we are giving best services.
Awarded for Best District Hospital Grade 1, Civil General Hospital, Junagadh.
We are working as a team, and I always keep on motivating people. And I always see that my juniors under me blossom under me. I never come in their way of work. They are my leaders. I have empowered them with all, come on, I tell them, come on, you do it, and I'll okay it. And in that way, our hospital has improved tremendously.
RSBY Award for Outstanding Service to the Community, Sitapur Eye Hospital.
It is with great humility that I accept this award. This truly goes to the founder of the Sitapur Eye Hospital, and he was no other than the famous Dr. Mahesh Prasad Mehre of Sitapur. His mission was to carry eye care to the footsteps of the patient. The reason was the villagers, all those people were ignorant and the communication was not good. So they were all there around Sitapur who were blind, who had cataract, and he carried eye care to their doorstep. And today we stand doing 80% free cases of cataract and 20% cases.
Awarded for Hospital with Medical College, Megapolis, AIIMS, Delhi.
I'm really thankful to CNBC TV18 and ICICI Lombard for giving this recognition to the institute as being one of the top medical institute in country, as well as providing the leadership in patient care research and the teaching, which is the mandate for the institute given by the Special Act of Parliament. And I am very happy that we have been able to fulfill whatever has been the mandate given to in the institute, and will be excelling in many areas which are remained unfulfilled so far. Provide patient care to everyone irrespective of their caste, creed or socio-economic status. We treat every patient as a very important patient, and whatever we can do for the patient, we have to do for the patient, and then we are doing for the patient.
Wilgrow Innovation Foundation Awards for Excellence in Primary Healthcare, Rural Healthcare Foundation.
We are nothing a primary healthcare provider. This journey started with 10 rupees note given by a beggar to us when we got her cataract surgery done free of cost 8 years back. That 10 rupees shows us the value of the money. We closed down our business. We made ourselves enough money to sustain ourselves and started this venture. This award goes to that 10 rupee and 11 lakh patients we have treated so far. Thank you.
Well, that was an eclectic mix of healthcare providers. Each institution featured in this episode is a story by itself. Each institution symbolizes a sense of commitment to better people's lives. One feels truly honored standing among these titans from India's healthcare industry. It may sound repetitive, but I once again say with a lot of conviction that may their tribes keep increasing so that India becomes a great place to live in. On that positive note, it is time to say goodbye from the entire team here at CNBC TV18. Thanks for watching CNBC TV18.
Focus, ideate, innovate, enable.